Skinfold site measurements are done to estimate fat body percentage using a caliper. It should be placed directly on the surface of the skin, maintaining a pinch when reading the caliper and waiting approximately 1 to 2 seconds. Remember that all measurements are done on the right side of the body. The 7 sites to measure are the tricep, subscapular, mid-axillary, chest, abdominal, suprailiac, and thigh. Remember to place the calipers exactly 1 centimeter away from your thumb and index finger when measuring. Measuring the tricep is done on the posterior midline of the upper arm, halfway between the acromion and the olecranon process. Measuring the subscapular is done 1 to 2 centimeters below the inferior angle of the scapula at a 45-degree angle. Diagonal fold should be done when measuring the subscapular, suprailiac, and the chest. The chest is done between the anterior axillary line and nipple for men, or 1/3 of the distance between the anterior axillary line and the nipple for women. Vertical fold should be done when measuring the mid-axillary, the abdominal, the thigh, and the tricep. The mid-axillary is measured at the level of the xiphoid process of the sternum. When recording for the abdominal skinfold site, remember to go 2 centimeters to the right side of the umbilicus to get an accurate measurement. Measuring for the suprailiac, it is directly in line with the natural angle of the iliac crest taken in the anterior axillary line immediately superior to the iliac crest. The thigh measurement is done midway between the proximal border of the patella and the inguinal crease. The 4 formulas used to measure this are the body density formula for men, body density formula for women, the Brazek equation, and the Siri equation. After inputting the information into the body density formula for men and women, you can then insert this information into the Brazek equation or the Siri equation to find body percent of fat. Retests are only to be administered when measurements are not within 1 to 2 millimeters. You should take 2 measurements on each site, but rotating appropriately through each one first before moving on to the second assessment.